give. Okay. So the key here is setting up everything. So on this mannequin, okay, I'm going to use the deltoid. Okay, and how much can go into the deltoid? 1 ml. Okay, where are the other spots? Okay, ventral gluteal, vastus lateralis. Okay, the ventral gluteal is right over here on this mannequin. I can't turn this one. I don't think this one has no, this one does not have the dorsal gluteal on it. So you've got 3 spots, okay? If it's less than an ml, you can use the deltoid. If it's about 3 ml or less, you can do the ventral gluteal, okay? And the rectus femoris is the largest, or the vastus lateralis, excuse me, vastus lateralis is the larger one, so you can, it's still up to 5 ml there, okay? Now it's important too, okay, to note what? Before, picking up the equipment that you're going to be using, the types of syringes and needles. Okay, the size of the person. What else do you need?
Skin integrity.
Okay, what else?
You already said we have a shower.
Yeah, it's an IM, but you need to pick the location. So the mounts will vary, so you need to know that, if you have to give 3 ml, you're not giving it in the deltoid. Okay? So that's important for you all to recall. All right? So the viscosity of the fluid is really important. Now, when you choose your syringes, obviously, you'll pick according to, what amount you're going to be giving. So if it's 3 m, if you're giving, let's say 1.7 ml, you have to use a 3 ml syringe. Okay? And you have to make sure that you read and, pull back the exact same amount. Okay? So, what was I doing with this one? Hold on. Okay, choose the amount. Okay, so you use the right syringe. Needle size is also important. Okay? So, the length as well. So, the gauge and the length. Okay? So, when you're looking at smaller sized people, okay, especially if you're in the deltoid, you have a choice of 1 to 1.5 inches. Which one do you think you're going to use?
1.
A 1, okay? Because you don't need to go all the way to the bone and hit it, okay, with a 1.5. Okay. The gauge of the needle, too, depends on the viscosity and the amount of fluid that you're going to be giving. And what's the gauge for typical IMs?
22 or 24.
5.
Okay. 21 to 23. Okay. 25 to 27s are sub-Q.
Isn't 22 gauges up, you can't insert blood?
That's for IV.
Yeah.
Yeah, and that's true. Okay. But with the the injections, it's usually a 21 or a 23 gauge that you typically see. Okay. So depending, like I said, the amount and the viscosity. So if it's really thick, you're going to go with what size? A 21 or a 23? 21. Okay, because the bore of the needle is larger. Just remember, it's the opposite of a French. Okay, because the French catheters, we've got a 12. The smaller the number, the smaller the diameter. As with the needles, as opposed to the French side, the gauge, the bigger the number, the larger the number, the smaller the diameter. Okay. All right. So I'm going to wash my hands. Use my hand sanitizer. Okay. So I'm going to give 1.7 ml of solution. Okay. And I don't put my gloves on until I'm ready to actually inject. Okay. Because I can't manipulate really well with a lot of this stuff. Okay. So use some alcohol. Okay. So I'm going to wipe the vial. Okay. And I want to make sure that the vial, the solution is clear, not cloudy, it's not expired, any of that sort of thing. Okay. So I've wiped the top of that off. And as you can see on this one, it tells you a 3 ml, 22 gauge, 1.5 inch. Okay? Okay, now, we're going to have different pieces of equipment out here. You need to pick the right one. Okay? All right. So I'm going to pull the cap off, and I'm going to okay.
So are you going to say, like, you have a person that's
We're going to
small,
give you a scenario.
So you're going to have syringes that are
Yeah.
1 inch and 1.5?
Oh, yeah, we're going to give you varieties of different things. You need to pick the right
I'm
equipment.
excited.
You're gonna pick the right equipment. Okay, so you need to make sure that you draw up the correct amount of air. Okay, you have to put the air into the vial first, correct? So it's 1.7. Okay, so I'm gonna put that in. Inject the air, and then making sure that the needle is below the level of fluid and draw up my solution. And once I've done that, making sure I don't have any air in here. Then I'm going to recap very carefully. Okay, and then I'm done. Okay, y'all saw that? That was very easy. Okay, now I'm going to put my gloves on.
Did you inject air into the valve first?
Yes, because it's a vacuum, so if you don't,
Yeah.
you're not going to get anything back. Okay.
Like I said, that's the hardest part of this class.
Mhm.
I'm just going to right here. So I'm going to take my alcohol swab, but first, before I do that, I want to make sure that I've got the right patient. So what do?
Ask them their name and date of birth.
Ask them their name and their date of birth. You tell them that you're going to be giving them an injection, that sort of thing. So we'll swab the area. Okay, and you can use a Z-Track.
And with the deltoid, you can massage.
Yeah, IMs you can massage. Okay, the sub-Qs you don't. What else do you need to do with an IM?
Alcohol wipe.
Pull back for
Go
what?
back and check for,
Oh, for blood.
For
Blood
blood.
return, because if you get a blood return, what are you gonna do?
throw it away and throw it
Throw it away, start all over again. Okay, which happens, okay? So now we're ready to go. Okay, so I'm gonna pinch, and you're gonna use a good darting action. Okay, aspirate and inject. Okay, pull out and massage. Okay? And then discard. Any questions on that? Not hard, is it?